The 14th Network of African Parliamentary Committees of Health two-day meeting has opened in Kampala for policymakers to discuss health-related challenges facing African countries. The meeting, running on the theme Building the Capacity of African Policymakers for Achieving Universal Health Coverage and Sustainable Development Goals, the role of parliamentarians, has attracted participation of over 16 African countries. Minister for Health Uganda, Dr. Ruth Aceng, represented the Speaker of Parliament, Anita, and stressed the need for Africa to focus on manufacturing of health supplies.
We must focus on manufacturing our own commodities, pharmaceutical commodities, and stop this attitude of begging or waiting for donations. That is not Africa.
Minister for Information and National Guidance, Dr. Chris Bariomsi, implored African governments to effectively implement international and national commitments to improve health service delivery among African countries.
We definitely needed to allocate more resources to health and health care. And there have been discussions before where even our leaders agreed to raise the percentage to 15% to be allocated to health. It could even be more than that. And I think time is now for us not to over-rely on borrowing and getting resources from outside, but we use our own domestic budgets, our own internally generated resources to invest them in health so that we can improve the quality of life of our own people.
The program officer at Partners in Population and Development Africa Regional Office, Dr. Patrick Muchira, hinted on the issue of this high-level meeting, coming up with a Kampala call to action.
The theme for this meeting is universal coverage and sustainable development goals. So the Kampala call to action will be a blueprint to guide implementation of some of the key actions towards accelerated achievement of VHC and SDGs, looking at the role of parliamentarians.
This meeting has come at a time when there is consensus that African countries face similar health challenges, and therefore there is need for combined efforts in finding solutions. Diana Kuti, UBC.